Hey everyone, today we are going to see an important topic, the Down syndrome. How is Down syndrome identified during pregnancy? How can it be avoided? In the 11th week, the baby's neck straightens. When this happens, the only vessel between the neck and the shoulder is the one carrying the lymphatic fluid. In the 11th and 12th week, the size of this vessel drastically reduces and the blood vessels start developing faster in normal babies. But in babies affected by Down syndrome, the growth of these blood vessels is at a lower pace. If the situation persists in the 11th and 12th week, the chances of the baby having Down syndrome are high. When looking for this disorder in the scan, the heart also has to be checked. Babies with Down syndrome have nearly 70 to 80% abnormalities in their heart development. Parts of the intestines appear exceptionally bright. This brightness intensifies further in the 15th week. For some babies, the intestines appear as separate portions in the abdomen, part of them bright and part normal. In the 11th week, the baby's bones start to develop. Bone length can be measured in the 15th week. Based on the images observed in the scan, Down syndrome can be suspected, but can be confirmed only in the 20th week. Presence of the additional chromosome, if any, can be detected by the amniotic fluid testing for karyotyping. Babies with Down syndrome lack proper brain development. It is heartbreaking to bring up such a baby. In addition to mental retardation, congenital heart problems can also occur. Apart from the 21st pair, the presence of an extra chromosome in the 18th pair also results in many birth defects. Hence, 18th, 21 chromosomes need to be tested without fail. Apart from these, other disabilities can also be identified in the first 3 months of pregnancy, including inappropriate growth of the head. In the 10th week, the intestines go inside the abdomen and the outer layer of abdominal wall is closed. The intestines cannot grow outside the abdomen. There can also be defects in the development of bones, example shorter bones. Bones fuse only after the birth, especially those of the cranium, head. That is why the top portion of a baby's head is soft. The brain is situated below this portion. The bone at this portion is not yet developed. If the bones in the cranium fuse early, baby's brain cannot grow and it may not be able to survive. Hope this information gives you an awareness about Down syndrome. Have a happy pregnancy. Thank you.